welcome to episode 3 of Legal Podcast. I'm Ardra KR, student coordinator, 14 Government Law College Thrissur for the 4th edition of V.S. Mallar Memorial Legal Aid Competition 2025-26. And today for our legal podcast, we have our keynote speaker, Dr. Deepthi ma'am here. And she's a renowned gynecologist who's an expert in the field of gynecology, obstetrics and women's health. And we're very happy to have you here, ma'am. And we also have our faculty coordinator for our legal aid competition and our principal in charge, Dr. Sonia Kedas. And we also have our faculty in charge, Divya ma'am, assistant professor of law.
And what I would like to add to you is that Ardra, Dr. Deepthi, she's a she's a constant rank holder. For 10th standard she was a rank holder, and for MBBS and also PG she was a rank holder, and she's an apt person to talk about this topic. And what we would like to discuss today is regarding the sexual and reproductive rights of women. Because when we speak about women empowerment, we have to take into consideration all the aspects. When we discuss about women and law, the sexual and reproductive rights of women is an important facet of it. To what extent, because women can claim autonomy in different areas, and to what extent women can claim reproductive autonomy. I think you will be in a better position to explain that.
Yeah, thank you. Actually, it's a very important question, and I think I should be very proud to say that I am in a field where I am daily interacting with women of reproductive age group, and in fact, if we are spending more time, we will understand that, okay, they are all empowered and all, but actually that is not the situation, sadly. What is the main problem is, even though you think that gynecologists are seeing all patients day in and day out, the time what we spend with them is very little, because it will be a very busy OP. We see them physically. Whether we are really getting into see their mental status, still I'm not very sure, including myself. All our colleagues, all of them are busy, they are seeing, they are talking, they are just treating their symptoms, but whether we are looking at their mental status still is a question. Because of that, I don't know how much we are actually helping them in their mental status, but still, because we are dealing with the delivery side, obstetric side, we will be with them throughout 10 months. And if our eyes are open, we are literally seeing that they may be physically fit, but most of them are mentally not fit. So I usually take some time to dig into their history, their family background, how the family is set up. Of course, the generation have changed. We know that youngsters like you, we are stepping into the new world. Now it is your decision when to get married. Because earlier, when a girl crosses the age of 24, oh, marriageable age is over, you should get married. That was the time, I believe, me and Sonia have gone through. Now my daughter is 26, she is asking, marriage, a big no. First I have to think about my career. So now what we are getting is the people, of most of them, they are getting married lately. So the delivery also, the pregnancy also, some of them are deciding after 30, 35, whenever it is convenient for them. It has a good side and a bad side. Good side is they are more economically stable, maybe mentally they are more stable. The partners have taken a common decision when to become pregnant, so they are in that journey throughout together. But unfortunately, when the woman's age goes past a particular age, we are getting more complications, more health issues, more of them going for IVF treatment, etc. If your question, to answer your question, still have they got a choice when to be pregnant? I think for the majority of the society, still it is no. Though the changes, the good things have started happening at the upper strata of the society, that percolating to the middle and lower strata, still we will have to wait to get the results. Because even though we say that partners, now as I told you, we are seeing most of the couple coming together. And for delivery part, they are staying together. Husbands are insisting they want to become with their wife. After delivery, they are staying with the wife, taking care of the baby. They have no inhibitions for that. Sonia, can you imagine that around 20 years back?
Yes.
No, because at that time, husbands will not be there anywhere near the decision point of the labor room. But now they are getting activity. That's a good change. But at the same time, still we are in a society where society has many taboos, many decision makers. I still feel the decision makers are both sides, parents, relatives, uncles and aunts, where they have not seen even in their lives. They all come together at the time of the marriage and delivery and make their choices. So there will be sometimes a coalition of their ideas. Sometimes it will be a problem with both of them going in opposite directions. These are all happening. But for a woman to decide when they should get married, And after marriage, when they should become pregnant, can they practice contraceptive choices? Still, that group of a couple coming to me is less. So I think the reproductive autonomy in the actual words is a little more far away.
So what stand as a hurdle to this progressive change?
Basically, you have to have education. Original, true, genuine classes. Why I said that everybody is now after the social media. Whatever is spread in the social media, they think is right. Because one person going for a delivery to the labor room, they are giving a pregnancy video and they are making it like, okay, this is what is happening everywhere. No, I don't know, I've been practicing for more than 20 years now. I still don't know how many babies have gone through my hands, but each delivery, each pregnancy, each journey is different. Everything will have their own unique good things and unique problems. So we have to address to that. But people still, because now the social media is there, everything has become faster. So I don't know whether this space is our friend or enemy now. They are getting so much of information flooding. But 90% of them are not genuine or not correct. So this young generation is easily getting swayed by that. So they come to us with the fixed ideas. This is this. So to sit with them, to talk to them, to communicate to them is the ideal thing which a doctor should do, which I believe, unfortunately, it is sometimes lacking in our speciality. But most of us have now changed. We are all taking time to make them understand what it is. If they genuinely understand what it is, then they will have a more choice. Especially it should start from schools. Earlier we used to say used to go to sex education and all those classes about reproductive health and all, only to +1, +2 students. We thought only from 15, 16. Now an 6-year-old kid will tell us what is this. So all this education sex education should start from the lower classes, because I had a very good experience. One of the schools in Thrissur where they promote co-education, they called me for a class, a health education class. What they did was they made students from 6th standard to +2, both boys and girls sitting together for a class. In fact, in the beginning I was a little confused. What I should be telling to a 6th standard student is not the one that needed for a 12th standard. But I thought I'll make us a try. But afterwards, many parents called me, because the kids, a 7th standard student is going back and asking mom, do you have pain during your particular month? Are you suffering? Do you have this problem? For the first time he was listening to that. Afterwards he was more loving towards the mom. Maybe a 12th standard student may be perceiving it in a different way. So it was about relationships, all their cultures and everything. So in that class we tried to cover everything. So it was a good experience for us also. So that is why I think it should start from the lower classes. Basically it should be about the anatomy, the physiology, the mental changes, hormone changes that all of you will go through. Because when they know about something, they will be ready to face it. So once that thing comes, like how to respect your partner, and what is about marriage, when should you become pregnant, what is this pregnancy journey, everything if they know little earlier, they will have that mental status to decide about their future. So I still feel education is the basic step for that.
Even in today's relevant society, do you think that there is still preference for some?
Very tricky question, but still I feel that preference is more for sons. It's a hard truth, but we have to accept it, because what I have seen is people are very eager to know about the sex when they are pregnant. And do you know, I think you will be knowing it much better than us, that PNDT Act. So in India, why PNDT Act is so strict is because so many female feticides are happening. So we thought it must be happening in North India. In a well-educated state like Kerala, is it happening? Unfortunately, still yes. There are some districts which are still marked as red in the ratio between male and female. Because there is a system that every pregnancy goes into the registry. So every pregnancy is going into the registry. All abortions are registered. So at the end of the thing, all live births are also registered. So it should be matching, isn't it? Number of pregnancies, number of abortions and number of live births.
That's how we take the statistics.
Statistic when they take, when there is a gross disparity, where have some pregnancies gone without getting registered in an abortion, that is a medically medical
how our
abortion.
person termed it as missing girl children.
Missing girl child. So actually what's happening is, still people go to quacks for termination of the pregnancy, they actually ask me, can we know the sex? I believe everybody thinks that in the ultrasound it is written what is that the doctors will be knowing it is a male or female. We are not disclosing. No, we don't see that. Actually, during the scan, that is during the anomaly scan, you have to specifically target to see the sex, whether it is a male or female. And because the law has inhibited it, nobody is looking at it.
Otherwise, you can't make it out.
We have to specifically look for that. Sometimes when the baby is rolling, because in the ultrasound screen, the baby is rolling in front of us, so they will be sitting, lying there and all. That radiologist will be able to understand. That's a different thing. But still, we won't directly go to that to see the sex. Though I cannot say 100%, I believe 90-95% of doctors are following that practice. But when the people come from abroad, the main complaint we get is, there they tell us the sex. Here you don't tell us. And there they allow us inside the scan room. We can see the screen. But according to the law, disclosure of the sex is an offense. You know that. How much punishment we will get, that you should be telling. Second is, even the screen, they will not be disclosing to anyone. Because this is not a match or something like a funny video to see. This is something very serious we are looking. The baby's health, whether the baby is having any anomaly, the growth parameters. So there our focus is on a different thing. But sex determination, still it is getting done. And when I go to outside the labor room to say the baby is so and so and all, when I immediately say the baby is a girl, sometimes, or I should say at least 50%, I see, oh, 50%. Oh, immediately I feel like reacting, but then I keep quiet. But sometimes some parents are proudly saying, we wanted a girl. We haven't even selected a name for a girl, and we have never thought about anyone other than a girl. Again, it all depends upon the empowerment you have got from your home and how much the partner is respecting the female. I'm not saying female is much higher than male, but whatever baby you might get, it should be healthy. That is the only concern we have. The baby should cry and the baby should be healthy, and when we hand over, it should be looking very pink and term baby. There, whether male and female is none of our, we never think about that. But sometimes they come back after 3 female child and then they have a male child. When we go outside, we can immediately see from the reaction of the relatives, not the parents per se, but the relatives, they'll say, oh. So immediately I try to take a minute and tell them, do you know how the sex is determined? It is not determined by the mother, it is determined by the father. Because mother has 2 X chromosomes, father has a X and Y chromosome. So which chromosome meets with the X, that decides the sex. So it is not the mother, it is the father.
Yeah, we are studying that right from the school, but the thing is that nobody is trying to understand the facts.
Studying is a different thing,
yes.
Understanding is another thing. So people immediately say, no, the thing it is the fault of the woman. That is sometimes indirectly they implicate that, oh, this time also it's a female. I know that when I go to their room for postnatal rounds and the 2nd day, 3rd day, that general environment over there, when they are got 3 girls, 4 girls, like that. So I always tell them, you are fortunate, you have 4 girls. These 4 girls will be competing with each other to look after you when you are sick. I'm not saying boys are not looking after, but to have whether male or female, the preference, that is a bad trend. So still female feticides are happening, and unfortunately, people are going to unqualified costs even in this century for abortion services, and that is increasing abortion related problems also.
And what about the mental health related to pregnancy? Because recently we have seen so many news reports where the young mothers, they are committing so many offences upon their children. So what about the importance of mental health during pregnancy?
Mental health is a problem starting from birth now these days, because every psychiatrist friend or psychologist friend of mine tells that they are getting counseling for 8-year-old, 9-year-old, 12-year-old, school kids. They are having stress. We also had gone through the same thing, but I believe the pace is taking its toll. So they don't get the time to sit, relax, think and decide on their own. They are decided by the peer pressure, the social media, everybody's expectation. So the stress level is very high.
But
the
nowadays
speed.
we are reading much more about postpartum depression.
Yeah, postpartum. So that particular stress will be there throughout pregnancy also. Because I'm adult, we cannot actually take away the pregnancy part as a separate chapter. It is a continuation of what they were yesterday. So a couple who is entering into a pregnancy with so much of anxiety, they will carry that anxiety throughout pregnancy. 2 reasons are there. One, they are not getting proper antenatal classes. because they think everything like in reels. They are coming, delivering, sitting, smiling and going. No, when they get a bleeding, when they get something untoward like an abortion, they are shattered. So that is why breaking the news is also important. So in the first visit itself, the pregnant lady's mental status, we have to assess. That is basically the important, along with the partner. So are there any other factors pre-existing, like related to your job? Like there are so much stress on this bank jobs, IT jobs, every job. So job related stress. Then they are having financial problems. Sometimes undue expectations from their relatives. Everything they carry towards the pregnancy. So that part is there. And some people, they have a depression on their own. Depression is now accepted as a disease. It should not be like, oh, because of this she had a depression. Because of this, no, it is a disease. It is like a hypertension, diabetes. Because even if there are no reasons also, there can be depression. So identify whether they are having a primary depression. Some of my patients, they openly tell me, madam, I'm feeling sad for no reason. Then I try to see their history, medical, everything. There won't be any reason. Then the mother or mother-in-law says, oh, avalku verude tension. No, not a verude tension. It is a depression. So identify whether it is a depression or anxiety. Again, there are many categories. There can be depression, there can be anxiety, there can be bipolar disorder, many facets. So we have to identify. When that patient is coming to delivery, again, pain is something which they all think about pain. Oh, there is going to be huge. Everybody adds on to, oh, bhayankara pain. There will be huge pain, severe pain. So they come with lot of unwanted things in their head entering into the labor room. And inside the labor room, most of the centers, they are alone. There will be staff nurses, there will be doctors, but they are all new to them. So having a birth companion with them, that is an ideal thing which should be very kind to. All of us are ladies. We all have gone through that stage, maybe except Ardra, I believe. So when we are inside the labor room, having a familiar face with them, that is a concept of birth companion. It is catching up. We are doing regularly in our hospital. Somebody should be with her throughout. That again takes away some of the anxiety. Medical related anxiety, I always tell them, this is what is happening. This is what is going to happen. This is what we are planning. So they know what to expect. And pain relief, we give them whatever method they want. And for the delivery, normal delivery, we keep the husband as the companion. I have seen that the bonding is increasing and the anxiety is reducing. Husband being a part of the delivery, once after the delivery, they are so relieved because they know what has happened. Coming to the postpartum, if all these factors will be adding up, something pre-pregnancy, during pregnancy, intrapartum, during delivery. Then coming to the postpartum side, they will have a lot of hormonal changes. We call it postpartum blues. There is something called postpartum depression. If it is persistent, we call it postpartum psychosis. Identify it in the initial days. Give proper treatment. We can prevent it. But unfortunately, still yet, we have not started looking into the mind. But we now regularly seeing people coming out saying, I am not happy postpartum. But because initial a few days is postpartum blues, then little persistent is postpartum depression. Treat it because they will be losing sleep. And all the society will be coming and telling them how to feed. You don't have enough milk. You are not looking after the baby. And you have lost your figure. You should sit like this. And when they are getting up, you shouldn't getting up. You should lie down. So many taboos. And how can a young girl go through this? It's very difficult. And earlier, we were a joint family system. So they will be seeing some of their cousins going for delivery, coming back postpartum. Now everything is nuclear family. They get information from social media or from doctors. When doctors are not talking, they get it from the social media. So I cannot blame them alone. But postpartum, we should identify. Otherwise, they are killing their babies. One girl I saw in a report, will I kill my baby if I was in the proper state of mind? It's a very sad thing. But postpartum period, we try to read their mind. And there is a government program also now going on for the Amma Manasa. That is all for there is a questionnaire. We ask them to fill it. And when
even in all hospitals you are giving this
ideally we should be giving if you are not talking. So these points you should be filling up. From that you can pick up whether they are going through. But one problem we have seen is we will be identified. We would have told the patient also would have realized. But when we ask them to take therapy, immediately there comes the social taboos. No, we don't want that. Will it kill the baby? Will it be harmful? No, drugs are not harmful. Will it be harmful for the baby? Or what will others think? So the girl is made to suffer because the decision is made by people other than her. That is very sad state.
Ma'am, don't you think still the use of contraceptives and pregnancy, it's the burden is still on the women's side, right?
In that stage, I say people think that they're empowered because throughout the burden of pregnancy and to decide like how to space them and all, the woman should take the burden, but they are not helped by the society or the partners. Because when to become, we have already spoken about it, contraception is a woman's right, and there are many methods of contraception. It should be customized. We always say it is like a custom made thing, because now these days you believe in customized dress, customized videos and all. So the contraception also, something which is ideal for you may not be ideal for you. So we see the age, what are their ideas, how long they want to postpone, what are their medical risk factors, obesity, etc., etc. So whether there are there are many spacing methods, permanent and temporary spacing methods as well as permanent. But what we have seen is, even though we talk to them, many people are very apprehensive to ask. They think it is a taboo topic. Second thing, even if we go out and tell them these are the methods available, they are all scared whether it is injurious to health. So they don't use it. They'll land up in an accidental pregnancy. Sometimes that accidental pregnancy, they continue with so much of mental and physical trauma. Sometimes they go for an abortion. Again, the mental trauma remains. Again, physical problems come after that. So contraception, it is not that dangerous if we choose it wisely. And then in between spacing methods also. But unfortunately what we have seen is the contraception still the woman has to do, because for the permanent sterilization, male and female methods are available. Now these days, I believe the male sterilization has come down to less than 1%. So even though it is an easier method, many people are not aware, many are not ready to accept it. So if you are talking about a reproductive autonomy, when to become pregnant or when to get married, how to space, along with that, what contraception to use, that is a major decision that should come from the female. Everything goes with counseling and education. So women, when they enter into a marriage, they should be aware these methods are available. And some people come and some women come and ask me for a property and all, and said, please don't tell my husband. Please don't tell my husband. But according to law, the right for contraception, right for sterilization is a woman's right. Even if the husband says no, if the woman is above 18 and is mentally stable, we are supposed to be doing it. But immediately what the reaction is, oh, husband is toilet, so husband doesn't like it, don't do it. No. So the outset of the community, including myself, the doctors, everything should change.
But again, we have a paradox there, because when we go for divorce, if these things are done without the consent of the husband, it becomes mental cruelty.
How does it become the lawyer should be answering
that's
that?
The thing.
So the
because law has sometimes double standards. That's the problem.
You shouldn't be telling that. Even the outsider should say. But I believe there is always a via medium in between everything. So basically it is all about communication. Yes. And we don't have time for that. But to have a husband and wife address their problems, tell all these things, it takes 15 to 20 minutes per thing. Nobody is utilizing, but once in a while we should be sitting with them and talking to them. And if you are not able to do that service to the society, you shouldn't be seeing that many patients. That is usually my principle.
And again, what about the access to abortion services?
Access to abortion services, we have very clear medical indications for abortion. And you know that now the abortion, that duration has been extended. Yes. The upper limit has been extended to 24. It's a big relief for us doctors. Usually what happens is that 18 to 20 weeks was our anomaly scan. Sometimes some anomalies will be missed. We happen to get it in 20 to 23 weeks. Mm-hmm. I'm talking about anomalies which are lethal, where the baby will not survive, not the small things and all. Yeah. So in that day, we were forced to continue the pregnancy. Just imagine the mental trauma. A baby which is going to die after delivery, we are asking her to continue for 10 months, then deliver, and then the baby is going. So now the law has come up to 24 weeks, though rules and regulations are a little different, because up to 20 weeks, one doctor is needed. From 20 to 24 weeks, two doctors, two opinions should be there. And only in rare situations we go for 24 weeks, because after 24 weeks, it should be a medical board decided, because the complications increase once the gestational age increase. So unless it is a POXO or a rape case, or the marital status changes, they are becoming pregnant and they are getting divorced. Yes. So these are the small changes. But otherwise, when they come to us, something with a condition which is grave, which has got a grave impact on the maternal health, fetal health, or in case of rape, or a failure of contraception, or it will cause a great mental trauma to the mother, we are supposed to be doing that. The law has loopholes. When they say a failure of contraception, they will say we used a condom, it burst. How can you prove it? So that is how all pregnancies are, all abortions are legalized. But still, there are people who are coming for abortions at the drop of a hat. That also we strongly discourage. When they come for abortion, we talk to them what is the cause, whether there are any medical factors. Sometimes, with some of our mental support, a little amount of talking, they'll be ready to continue the pregnancy. And sometimes it is really medically indicated, we do that. I don't think in Kerala you have got any problem for access. And again, when they come for abortion, we are not supposed to be asking even about marital status.
Yes.
But they should have a reliable bystander, because we are giving medicine, any bleeding, any complication, we are supposed to be telling them. For that, we insist there should be someone. But it should be the husband, that we are not insisting these days, but they should be above the age of 18 and they should be mentally sound to make a decision. But usually we talk and find out what is the reason. But the abortion services are freely available in government sector, in private sector, everywhere. In Kerala, I don't think it's a problem, but other states I'm not very sure about it.
So thank you, Deepthi, for sparing some time for us.
Thank you
So
so
it
much.
was quite informative session. So we are sure that the listeners will be benefiting out of this. Thank you very much.
Thank you so much.
Thank you, ma'am.